and this is probably the most important time of year, open enrollment. A lot of individuals who are already enrolled in Medicare do not understand how important it is every year to review your health care coverage. Even though you get a notice in the mail, you're supposed to, of changes in policy and coverage, sometimes they get lost in the mail, even though they got mailed in the mail. The other thing is the prices change, and those would be in your notice as well, that you sometimes receive and don't get as well. So a lot of times your prescription tiers, majority of times, will change under policies. And today, Malcom Marsh, he is going to present to you about Medicare in general for those who need to know about Medicare and what it means and how important it is to get enrolled. And he's also going to spend some time talking about the changes that we're expecting to see in Medicare coverage in 2026, and that includes prescription drug plans, Part D. That includes the Advantage plans, which is grouped into A, B, and D. The other thing that I want to mention is I can't iterate how important it is to review your policies each year. If you know of a neighbor or an individual that's on Medicare, only 10%, statistics show, nationwide, only 10% of people review their policies each year. And that's just horrifying. To me, it is. Because a lot of people don't understand that they can get some savings on their Part B, and Malcolm's going to cover that as well. And we see that. We see a lot of 70, 80, and 90-year-olds that qualify for the Medicare Savings Program, and that's the Part B premium being paid back into their Social Security income and never took advantage of that program.
Good morning, everybody. How are y'all doing? I love coming to the Blount County Library. This is one of my favorite things that we get to do every year, to come and spend time with everybody out here. Teresa, Melinda, everybody is always so nice and everything. Today, like Teresa mentioned, we're kind of just going to go over the Medicare basics, okay? Medicare is a lot, and it can be confusing, and it's always changing, and they can never figure out how to just make it simple. So let's kind of jump into it. So we're just going to go over what is Medicare, enrolling in Medicare, Part A and Part B. So Medicare is health insurance for three groups of people: 65 and older, under 65 with a disability, or if you have end-stage renal disease, and it's administered by the Centers for Medicare and Medicaid Services. The four parts of Medicare are Part A, which is your hospital insurance, Part B, which is medical insurance, Part D, which is prescription drug plans, and then Part C, which is Medicare Advantage plans, which are either going to be HMOs or PPOs. As far as enrollment is concerned, you're automatically enrolled in Medicare if before you turn 65 you're already receiving your Social Security benefits or railroad retirement benefits, okay? Not a lot of people getting the railroad retirement benefits anymore, but if you start Social Security before you turn 65, you're automatically enrolled in Parts A and Part B, all right? When you are enrolled, you're normally mailed your card about 3 months in advance, and it also starts the initial enrollment period, which we'll get into here in a moment. Now, some people do need to sign up for Medicare. These are people who worked past their 65th birthday, had like employee health benefits or something in that regards. If it comes to that, all you will need to do is reach out to the Social Security Administration, and then at that point in time, they'll be able to help you enroll, get you your Medicare card, and it'll have your Part A and Part B start date on it. If you're not automatically enrolled, this is your initial enrollment period, okay? So You have the 3 months before your 65th birthday, the month of your 65th birthday, and then you have 3 months afterwards, okay? Now, if your birthday falls on the first of the month, it'll start the month prior. So I know that's a little confusing, but for an example, let's say your birthday is July 1st, your coverage would start June 1st, okay? The way that it works is during the initial 3 months, you can look at plans, you can do comparisons, you can enroll and everything like that. And once you enroll, the coverage will start on that first date of the date of your month of birth. If you still haven't made a decision, or if you're still thinking about it, or you still want to make changes, you then have the month of your birthday and then 3 months afterwards where you can still make changes and choose a plan and things of that nature. The general enrollment period for Part A and Part B, again, if you miss enrolling in during your 65th birthday, is from January 1st to March 31st every year. During this time, you can enroll in Original Medicare, which is Part A and Part B, and if you enroll in January, your coverages would start February. Again, this is for people who missed their initial enrollment period when they turned 65, and they didn't meet the criteria for a special enrollment period when they retired or something like that, and then they want to go ahead and enroll. You have to wait until the general enrollment period. Now, normally, if you're waiting to enroll during this time, there can be a penalty that could be applied to your Medicare premiums. So it would be 10% higher for each 12 months that you were eligible but not enrolled. And you'll have to pay that as long as you have Part B. If you have employee health benefits, or if you're in a union coverage or anything like that, or if you've been on your spouse's employee health benefits and stuff like that, once they plan to retire or once you lose those employee health benefits, you can enroll in Part B immediately after those coverages end. We like to tell people to at least reach out to the Social Security Administration at least 3 months in advance, because we all know how Social Security Administration is, and it could take them a while to get those benefits started. So what you want to try to do is line up when those employee health benefits end, so that immediately as they end, your Medicare can start. Medicare Part A and Medicare Part B, we're going to talk about what's covered underneath them. We're going to talk about their cost. We're going to talk about how much the premiums are and the deductibles and things like that going into 2026, okay? For Medicare Part A, most of the things that are covered are inpatient hospital stays, skilled nursing facilities, hospice care, and any blood work that you may need to have done, okay? Now, for your Part A to be in effect, you have to have been admitted to the hospital for 3 days or longer. And that's fully admitted, you're in the hospital. That's what your Part A covers. Most people receive Part A premium free as long as you've worked 10 years or what they call 40 quarters. If you paid FICA taxes less than 10 years, you may have to pay a premium for Part A, okay? Now, those premium costs, and these are projected costs for 2026. We don't have official numbers just yet, but the projected cost for if you work between 30 and 39 quarters, Part A will be $310. If you work less than 30 quarters, it's projected to be $563. Again, most people don't pay for Part A. As long as you've worked and paid taxes for at least 10 years, you don't have to pay for Part A. But in those circumstances where, something may have occurred and you haven't worked and things like that, that's when these premiums would come into play, okay? Of course, if you enroll late, there would be a penalty. If it's free, there's no penalty, but if you enroll late and you didn't work enough quarters, then that penalty would be applied. For Part A, the deductible for 2026 is projected to be $1,716. And that covers days 1 through 60 if you're an inpatient at a hospital, okay? So for days 1 through 60, that's how much the deductible will be. For days 61 through 90, the cost would be $420 per day, and again, that's the projected cost for 2026. For a skilled nursing facility, Medicare will cover you, that's if you have to go to rehab or anything like that. Medicare will cover days 1 through 20 at no charge, but anything from 21 to 100 days is $214.50 per day. Here's what's covered under Part B. Now, Part B is just your regular medical insurance. Your primary care doctors, specialty doctors, MRIs, CAT scans, things of that nature. It covers the doctor's services, outpatient medical and surgical services, some home health care services, durable medical equipment, that's your wheelchairs, walkers, things of that nature. Medicare will cover that as well. And it also covers other medically necessary medical services and supplies as well, okay? Anything that you're going to see a doctor for is going to usually be covered by Part B, all right? Here are some of the preventative services Part B covers, as far as mammograms, cardiovascular disease detection and things of that nature, certain shots, flu shots, hepatitis shots and things of that nature, lung cancer screenings, things like that. So in original Medicare, you do have a deductible, a yearly deductible. It's an annual thing. For the year of 2026, it's projected to be $288, okay? And again, that's an annual deductible. So once you've paid that deductible for the year, you're good. After you've reached your deductible, the way Part B works is Medicare covers 80%, and then you're responsible for the remaining 20%. And that's of any charge. There's no cap to that. So if you pay, if something, you get a CT scan, it's $1,000, you owe $200. If your doctor's visit is $100, you owe $20. Now, the projected monthly premium for 2026 is looking to be about $206.50, okay? Now, IRMA, which stands for Income-Related Monthly Adjustment Amount, that can change how much you may have to pay for your monthly premium. And what it means when it says 2 years is that, so for 2026, to determine if you would have an IRMA, they're looking at your taxes from 2024. Am I explaining that in a way that makes sense? They're looking 2 years back to determine what the price would be for your monthly premium due to the taxes that you have filed. Now, if some type of situation occurs and you feel like, whatever the IRMA amount is too unaffordable for you, you can go and dispute that with the Social Security Administration to see if they can lower that for you based upon what your income is currently. Okay? I know I've had people who they sold houses and things like that, so it bumped up their monthly premium. But of course, that was selling a house years ago, and the premium was still pretty high, so they were able to go into the Social Security Administration and get that put down to the regular rate. Now, of course, like I mentioned earlier, there is a penalty for not signing up when you're first eligible. It's 10% more for each full 12-month period, and you may have a penalty as long as you have Part B. Okay? Again, Part A and Part B together are what's known as original Medicare, okay? To help offset the cost of original Medicare, there are other avenues that you can look into, okay? There's what's called Medigap policies, and then there's Part C, which is the Medicare Advantage plans, all right? Medigap policies, all right. This is the fun stuff, okay? I need y'all to get ready for this. Medigap policies are what I like to call your a la carte option, okay? What a Medigap policy does is it does what the name infers by filling the gap that Medicare does not cover. So remember how I talked about, once you pay your Part B deductible, Medicare pays 80 and then you pay 20? If you have a Medigap policy, it fills that 20% gap, okay? The reason why I call it the a la carte option is because with the Medigap policy, not only are you paying the monthly premium for Part B, you would pay the monthly premium for the Medigap policy, and then with your prescription drug plan, you'll also pay a monthly premium for that. And if you want dental, vision, hearing, anything else, you'll pay those all separately, okay? But a Medigap policy, the way that the plans are set up are to give you the most benefit even though you are paying a monthly premium for it, okay? The costs vary by plan, company, and location. One thing that you have to keep in mind is that the Medigap policies, though they may be offered by different carriers or different providers, they are standardized to be the same thing no matter what company you get it from. You've had cable before in the past. You get your DirecTVs, Xfinity, AT&T, Spectrum, whatever you may have. Now, those are all different providers. But if you're going to watch CBS, CBS is the same no matter which provider you're getting. So no matter what company you're getting the plan from, it's the same exact thing. The only thing that really differs between the carriers is the rate that they charge you for the monthly premium and the rate at which that price increases, okay? So that's something that you want to keep in mind as well. In this area, majority of the plans are what's called attained age, which means that as you age, the monthly premium will increase. There's one community rated plan, I believe it's United Healthcare, and the way community rated plans work are if the price goes up for one person in the community, it goes up for everyone, okay? I don't know if you all can see this very well, but this is just a general overview of the different Medigap plans. They like to use these letters a lot, so it can get kind of confusing, but it's plans A, B, D, G, K, L, M, N, C, and F, okay? Now, the real popular ones that people normally go for are G, N, and you can't buy an F plan. You can only buy an F plan if you turn 65 before 2020, okay? But the only real difference between F and G is the fact that F covers the Part B deductible. Because of how limited F plans are, the premiums for them are normally really high, so it kind of defeats the purpose anyway, unless you already had it. But Plan G, if you look here, you'll see that it covers your Medicare Part A 100%. It covers all the co-payments for Part B 100%. Any blood tests or anything you need to have done 100%. Hospice care is also covered 100%. Skilled nursing facilities 100%. The Part A deductible is covered 100%, and any Part B excess charges are covered 100%. Okay? So what I always say is, as long as it's not a financial burden to you, a Medigap policy is a good way to go, especially if you already know that you have pre-existing conditions, okay? Because the way that a Medigap policy works is, whenever you initially turn 65 or whenever initially your Medicare starts, for that first 6 months, you can enroll in a Medigap policy, and at that point in time, no matter what carrier you're going with, they have to accept you, okay? You cannot be denied. If you try to enroll in a Medigap policy outside of that 6 months period, they can do what's called medical underwriting. This is Medicare Advantage plans, Part C. Now, remember how I called Medigap policies the a la carte option? Well, this is your combo meal. And this is what, put it all together. Medicare Advantage plans are health plan options approved by Medicare. They're still part of Medicare program and they're run by the private companies. They're also called Part C. The Medicare pays amount for each member's care. You may have to use network doctors or hospitals, and the types of plans available may vary depending upon where you live, okay? One thing that you want to keep in mind when it comes to the Medicare Advantage plans, they're either going to be an HMO or a PPO. HMO is a health management organization. PPO is a preferred provider organization. What HMOs do is you have to go to the doctors that are in that network, okay? So whatever carrier you get, Humana, United Healthcare, Blue Cross Blue Shield, if they're an HMO, you have to make sure that you're going to that particular in-network provider. For the PPOs, you can step out of the network, but the cost may be a little bit higher. For the Medicare Advantage plans, you do still pay the Part B premium, but a lot of the Medicare Advantage plans have a $0 monthly premium. So you're paying less up front, but they do come with co-payments and things of that nature. Another good thing about them is that they also come bundled with dental, vision, and hearing as well. To get a Medicare Advantage plan, you must have Part A and Part B. You must live within the plan service area, so you can't live in Knoxville and use it in Memphis. You have to live in the plan service area. Part D is prescription drug plans. What that covers is your prescriptions. To enroll in the Part D plan, you have to have Part A and either Part A or Part B. It's available to everyone with Medicare, and this helps cover the cost of your prescription drugs. The good thing about this is that they no longer do the coverage gap, or what was called the donut hole. So the projected cost that you would spend towards your medications is $2,100, and then that's capped, and afterwards all your medicine is free. There is a late enrollment penalty for Part D as well. It's an additional 1% of the base beneficiary premium. Now we're going to talk about extra help, Medicaid, and the Medicare Savings Program. Extra help helps to cover the cost of your medications. If you qualify for LIS, you will get a discount on your medications whenever you need to go to the pharmacy. These are the projected numbers these are the numbers for right now for that. If you are qualified, you would pay $4.50 for generic medications and $12.15 for brands. The Medicare Savings Program helps to pay the monthly premiums for Medicare. So if you meet the qualifications for this, and based upon which tier you qualify for, it'll cover that $206.50 each month for you. If you look at it here, if you qualify for what's called QMB, it'll cover all of those things: hospital deductible, the hospital co-pays, skilled nursing facilities, and the Part A monthly premium. If you just qualify for SLNB or QI1, it pays just the Part B monthly premium. But you have to meet these income guidelines to qualify. Medicaid. So Medicaid is what the state-offered healthcare system is called. In Tennessee, it's called TennCare. Now, you have to meet a lot of eligibility requirements to qualify for TennCare. Normally, it's if you have kids or if you're the guardian of kids, if you're under 65 and have breast cancer and things like that. But some people still do qualify for Medicaid even after they turn 65, if they get into programs like Choices and things like that. And the way that they work is they work in tandem with Medicare to help cover all of your costs for anything that you have to go to the doctor in regards to. Okay? I think that's it.